Going bigger with your breast implants could be one of the worst decisions you ever make. I've watched women go from a B to a D and stand in front of the mirror afterwards feeling like something still was wrong, and they can't place it. The surgery went fine, the implant was exactly what they asked for, and the results look nothing like what they were picturing. That happens because size is only one part of the decision in breast augmentation. The other part almost never comes up before surgery, and it's the part that decides whether you love your results or not. By the end of this video, you'll know what it is, how to check for it in your own body, and 3 questions to ask before anyone puts an implant in you. Before most consultations, women spend time looking at CC comparisons. They find before and afters, organized by implant size. They look up what 350 cc's looks like versus 400. They think about cup size, and they run all the conversions. Every before and after gallery sorts results by volume, and every online sizing tool asks you to pick a cc range and compare. And that whole research process trains you to think of this as a volume decision. How much do I want to add? So you walk into the consultation with a number in mind. The surgeon probably talks in cc's, you compare options in cc's, and then one of two things happens. Either the result is what you wanted, which means your anatomy happened to fit the frame you were using, or you get bigger but not better. The fullness isn't where you expected it to be, the shape isn't what you were picturing, and you had no warning that that was possible, so you can't really explain why it happened. The second outcome comes from making the decisions around the wrong variable. So why can the same implant look different on different women? So 2 women can get the exact same implant, same cc's, profile, same manufacturer, but come out looking completely different. One looks fuller, more proportionate, exactly what she was imagining, but the other looks bigger but not really better. Somehow the thing that was bothering her is still there. The implant was identical, but the results look nothing alike, which tells you that the implant was never the variable that really mattered the most. 3 things decide what an augmentation actually looks like. The first is the breast tissue you already have to begin with. How much of it is there, and what condition is it in? Tissue that's full and firm is going to hold an implant differently than tissue that's deflated and stretched after pregnancy or significant weight loss. The second is the chest wall itself underneath. So when I evaluate a patient, I'm looking at the frame the breast sits on, how wide the chest is, how the ribs actually curve, and you've probably never once thought about your chest in this way and how it's going to impact your implants. Surgeons think about it constantly because the same implant sits completely different on a wide, flat chest than a narrow, curved one. The third variable is where that fullness ends up once the implant is in. Is it up high, where your eye expects it, or is it down low, stretching the bottom of the breast? Notice what's missing from that list. The cc number. Volume matters, but it comes in behind all of these other variables. So here's what that means in practice. Say your breast tissue's lost volume and it's dropped, which happens after pregnancies or big weight loss. And sometimes it can just happen with the aging process. An implant goes in behind that tissue and does exactly one thing. It makes the breast bigger, but it doesn't move anything. Your breast was sitting low before the surgery. Now it's sitting low with more weight in it. You get more of the shape you already had, just larger. That's the woman who goes from a B to a D, but still feels like something's off. The size changed, but the position and the fullness didn't. Position is what your eye actually reads when you look in the mirror. So no one catches this before surgery because the whole process points the other way. You did CC research. You came in with a number volume in mind. The consultation is built to receive that number and work from there, but the wrong frame gets reinforced along the way. If this is the kind of thing that standard breast augmentation process doesn't surface, and it's the reason so many women end up confused after the results, subscribe so you don't miss the next one. I put out a new video every week on the clinical realities behind these procedures. So let's talk about the question that changes everything. The question that actually matters: does my anatomy call for volume, position, or a combination of both? Those are 3 different answers, and they lead to 3 different potential procedures. If your breast tissue has good volume, but it's dropped over time, you have fullness, but it's sitting lower than you want it. So a lift is what's going to change that. A breast lift repositions and reshapes the breast. After a lift alone, the breast often looks slightly smaller because the projection is now forward instead of down, and the visual impression of volume shifts. But they look the way where you imagine they'd look, and in a bra and out of it. Now, if your breast tissue has kept its position but lost volume, say after weight loss where the skin actually adapted but the fullness didn't come back, then an implant placed correctly gives you volume in the right location. Volume landing where your eye reads it as natural and proportionate. And if both have happened, so your tissue's dropped and you've lost volume, which is common after pregnancy or after significant weight loss, a breast lift and implant done together in the same surgery gives you a result that neither procedure alone could produce. The lift's going to handle the position, the implant handles volume, both in one surgery. Now, here's where CCs come back in. Even when an implant is the right answer, the CC is still not the primary decision. The same implant in two different women looks dramatically different based on where it sits in the chest, what profile it has, how much of their own tissue covers it. Adding CCs on top of tissue that's already sitting low gives you more of the shape that wasn't working to begin with. More volume, wrong place. So what do you do with this before your consultation? The answer to whether you need volume, position, or both is visible before surgery. So for every breast implant I see in our practice at Apre, I use a 3D imaging software called Chrysalix. It shows you your chest anatomy with your actual anatomy and with specific implants or procedures we're discussing. You can see what a lift looks like in your body. You can see what an implant looks like. You can see what both together look like side by side before you've committed to anything. A consultation should answer the right question before you're in a surgical plan that's built around the wrong one. The patient I worry about most is the one who had the surgery and is unhappy with the result and genuinely doesn't understand why, because from the beginning, everyone framed it as a size decision. So she assumes she just needs to go bigger again. She needed to be asking the right question before the first surgery happened. Many women who come in wanting more fullness actually need a lift, or they need a smaller implant placed differently than where they were imagining they needed it. So going smaller, placing it correctly, is going to produce a more natural, proportionate result than just going bigger in a position that doesn't match their anatomy. The conversation requires a surgeon who's going to look at your body as a whole and build the plan from what they see. Before your next consultation or before you finalize a plan you've already started, 3 questions are worth asking directly. The first, is this a volume problem, a position problem, or both? If the surgeon answers that before they talk about CCs, that's a good sign. And if they go straight to implant size, ask the question again. Second, what would a lift alone look like for me, even if you're certain you want an implant? The surgeon's answer tells you whether they've actually evaluated your anatomy or whether they're working from your stated preference. A clear answer means they've looked at you, they've built a plan from what they see in your anatomy. The third, can you show me what different options look like in my body before I decide? So practices like ours that use Chrysalix or similar 3D imaging like Vectra can do this. And if the practice you're consulting with doesn't have it, ask to see at least before and afters from patients with anatomy similar to yours, not just similar implant sizes. What you're looking for is a surgeon who can show you what the results will look like in your specific body before ever making a decision. When you shift from how big to what does my anatomy actually need, the consultation is going to change. And you're going to stop comparing numbers and start evaluating whether the surgeon has genuinely looked at you and created a custom plan. Breast augmentation is one of the most common procedures in plastic surgery. CC number is also one of the most commonly misused variables in plastic surgery. You're buying a result in your body with your chest wall, your tissue, your specific anatomy. And your anatomy has specific answer to the right question, and the answer is visible before the surgery ever even happens. So when a surgeon's going to sit down and show it to you. So if you want to know exactly what questions to bring into a breast consultation so you can tell whether the surgeon is actually evaluating you, watch my video, 8 questions every woman should ask before breast augmentation. It covers each question, what a real answer sounds like, and what a deflection tells you about the practice you may be in.